Danny Kruger.
Very grateful, Madam Deputy Speaker. We've heard some very powerful stories in the debate, and of course my constituents have written to me with similar very distressing tales of self-harm and attempted suicide, particularly conscious of the crisis in eating disorders services. So yes to the appeal for further services and further investment, and I recognise what the government is doing in this space, and I support that. But I want to talk briefly about the wider policy that the government and the whole country has adopted around COVID-19, and particularly around, I want to mention what I think of as the abuse of language that we've all been partly guilty of, the way the ideals of duty and sacrifice and community and putting your friends and family first, the way that this language has been suborned to a totally different imperative, to stay apart, to isolate, to cut off our relationships and our obligations, and to trust the agencies of a remote bureaucracy who knew better than you did what you should do, who you should see, what balance to strike between seeing a loved one and protecting them and others. And I don't blame ministers personally for any of this. I voted for it all. We did this together across the House and indeed with the support of most people in the country. We outsourced social responsibility to the state, and the state gladly took up the burden. And so we saw mass testing, including asymptomatic testing, which drove the figures so high, and that led us to mass lockdowns, despite the early evidence that the first lockdown, even if it was necessary to slow the spread of COVID, had health costs that outweighed the health benefits in some respects, to say nothing of the economic and social costs, including those that we're debating today. And lockdown was, of course, so awful that it created the pressure for the vaccines. And so after the mass testing and after the mass lockdowns, we moved to mass vaccination. Despite the early assurances that it would only be for the elderly and the vulnerable, it was soon for everyone, even children, unnecessarily. And despite the early assurances that it would only be voluntary, we piled on the pressure with COVID passes and, I regret to say, compulsory vaccination for health and care workers, which I'm hugely pleased that the government has now dropped. Mr. Speaker, I pay tribute to the colleagues who resisted much of this, and to the Prime Minister and the Cabinet, who after the vote on the 14th December corrected course, faced down the voices who were calling for further lockdown. And we are now one of the freest countries in the developed world. And this is a testament to our parliamentary system and to this Conservative government. And you look at what has happened, or is happening elsewhere, not just in Europe and Asia, but in places with the common law tradition. What has happened to the traditions of English liberty that we exported? So we have to lead the way. No more lockdowns, no more mass vaccination, and most of all, we must put children and young people first. We owe them all our help in the years ahead. I know ministers agree with this, and I hope we will work across the House to make things right. Thank you.